read out the question without, and if those who want to can send it to me, and that will also be considered anonymous. But yeah, any questions, you could raise your hand, put it on the chat, or just unmute and ask. Go ahead, please. Anyone? Any questions, any clarification? Okay, Sridhar, brother Sridhar, please go ahead.
Yeah, for a working professional, like I'm working in IT company, and I'm adult. So how many hours I should sleep? Is it 9 hours or 8 hours? And if I get up in the night at 2, 3 o'clock, and 1 hour like I don't have sleep, after 30 minutes, 45 minutes, again I go into sleep. So how to avoid that gap in between?
So one is that sleep requirement sometimes varies from person to person. So an ideal sleep time would be anything between 6 to 8 hours. Some people need about 9 to 10 hours of sleep also. So it is variable depending on your own need. But if you're able to sleep for 6 to 8 hours, and the important aspect to understand is when you wake up at the end of 6 hours of sleep, minimum 6 hours you need. When you wake up at the end of 6 hours of sleep, how is your day will tell you whether your sleep is good or not. So you should be feeling very fresh during the day. You should not be feeling drowsy during the day. All your physical activities should be good during the day. So if you slept for 6 hours and everything during the day is perfect, that means your sleep is good. Now, for the aspect that you said, the second question, suppose I'm waking up. So first thing that you need to do to ensure that you're sleeping well is follow all the sleep hygiene tips that I told you, which means I'm just going to recapitulate that. One is fixed time to go to bed and a fixed time to get up. Avoid gadgets 1 hour before going to sleep. Have a routine. So what you will do in that 1 hour? Many people tell me if I tell them avoid gadgets in 1 hour, what do we do? You train your brain to shut down. That means you will do all those things like I told you. Take a bath, change into a particular dress, apply a cream, listen to some music, say your prayers. So there is a routine. Suppose you wake up. If you're waking up and you're not able to fall asleep within 5 minutes, don't stay in bed. Get up and do something very, very boring. Read something which is very boring or watch something which is very boring. Then your brain will shut down, you go back to bed. When you keep on doing this consistently, automatically, then that cycle will break.
Okay. There's another question on the chat. How much sleep a teenager needs usually?
Yeah, so teenagers actually, to be very honest, the circadian rhythm changes a little bit when they become adolescents. So that is why they tend to stay awake a little bit later and they are, up till 12 or 1. Ideally, they need to actually, so the school system, unfortunately, is that they have to wake. So when they are younger, we actually send them to school in the afternoon. And when they are older, we send them to school in the morning. But in an ideal world, it should have been the other way around. Because teenagers, usually their circadian rhythm changes a little bit. But this is what it is. We can't change it. So they need to sleep for at least 6 to 8 hours.
Okay.
So by 12, the teenager needs to be in bed, not beyond 12 o'clock.
Yeah. What kind of breathing exercise can we do for proper sleep?
So any kind of breathing exercise. See, we have to understand that why we do breathing exercises is again to just bring about mindfulness. The breathing exercise is not actually giving you sleep. It is the pattern that I'm doing it that my brain says, okay, she has started breathing from right and left nostril. That means she has to sleep, right? So any breathing exercise, the simple thing is you breathe in to a count of 1, 2, 3. You hold to a count of 1, 2, 3, and you breathe out 1, 2, 3, 4, 5, 6. Don't do because we do these things when we are stressed. Our breath becomes tighter when we are stressed. So the breathing has to be very normal and relaxed.
Right, yeah. I think the next question is again about teenager sleep, so which you already answered. Okay, waking up in the middle of night due to urination, this interrupts the sound sleep. Any advice?
So, waking up in the middle of the night for urination, especially as you grow older, is a normal process. The more we grumble about it and say why it's happening, it's normal. Like I told you, when you're 90 minutes of sleep, that means when you finish from stage 1 to stage 5, your brain is going to wake up. And then your sense, because you have a smaller bladder or because you have prostate problem or you have diabetes, the sensation will come to go and pass urine. So that is a good signal. Go pass urine, come back, fall asleep. It's not going to cause a problem. So don't worry if you have to wake up to go to pass urine. The worry is when you come back, how long does it take for you to fall back to sleep?
Right. Yeah. How much sleep does an adult need to function well? I think a 26-year-old's asking this question.
So adult same, like I said, 6 to 8 hours of sleep.
6 to 8 hours. Yeah. How much water should we have before going to sleep?
So ideally, you should have about 2 liters of water in a day. Right. And if you are somebody who's going to pass frequent urination, you must limit your water intake post 7 o'clock. So if I'm saying 2 liters of water, don't drink the 2 liters of water before you go to bed, because then you're going to be using the washroom again and again. So 2 liters of water throughout the day. After 7 o'clock, like I said, only if you have trouble going again and again to the washroom, reduce your water intake after 7 p.m.
So there are people who are nowadays taking sleeping pills, Zolsoma and all of that. So are there any side effects of sleeping pill? That is the next question.
So we have to understand that like I told you, right, the sleep is extremely important function. So if I'm not able to sleep well, the first thing that we have to find out is what is the reason. So just taking a sleeping pill is just going to be a temporary fix to the problem. So find out what is the problem. Is it just a lifestyle issue? Is it something in my environment? Is it obstructive sleep apnea? Is it restless leg syndrome? So various factors you find out first and then treat the cause of it. Certain sleeping pills, especially in the elderly, is completely safe because if they are not able to sleep well, that's going to cause them problems. All the medications are not sleeping pills. But taking a sleeping pill over the counter, your family physician giving you alprazolam and those sleeping pills is not good in the long term because then it causes problems in memory. So treating the cause of the sleep problem is more important rather than using the sleeping pill.
Is long-term use of melatonin safe?
Yes. Melatonin is one of the safe things because, like I told you, it's a natural ingredient that is secreted in your brain. If your pineal gland is not secreting enough melatonin, then if you're consuming melatonin, it's completely safe.
Okay. The right position to help sleep, is there anything like a right position?
Whichever position that you are able to sleep well is the right position for you.
Correct, correct. Okay. So what foods induce sleep so we can have these before sleep? Is
You have to avoid, like I said, a heavy meal. Anything that helps in secreting serotonin or tryptophan, food rich in tryptophan, which gets converted to serotonin. So it can be, like I said, milk, it can be cinnamon water, and so many other things which help in tryptophan, which is actually the one which gets converted to serotonin. So that are some of the sleep, helping agents. They won't help you induce sleep in you, but they'll act as an add-on factor.
yeah. Okay. Any other question, please, you can unmute and ask straight away because the question in the chat are almost over. Is an hour nap in the afternoon or evening advisable drinking tea before 4 p.m.?
If you don't have a sleep problem, then you can take a nap in the afternoon. My
Correct.
mother is somebody who takes 2 hours nap in the afternoon and still can go to bed at 9:30 and get up at 6 in the morning. I am somebody who actually needs a nap in the afternoon because without the power nap, I will not be able to function the rest of the day.
Right.
But if you are suffering from sleep issues, you're not able to sleep in the night, then you must avoid daytime naps because that daytime nap is going to cut away from your night sleep.
Mhm.
If you feel, no, I want to sleep in the afternoon, fine. then be sure that your night sleep is going to be a little lesser, which is fine. Understand that I am going to sleep for 6 to 8 hours in a 24-hour cycle, and that's okay. Again, if you're struggling with sleep, only then you must avoid tea and coffee post 6 o'clock.
Right. Yeah, Billy, please go ahead.
Yeah, just want to ask a question on restless leg syndrome. I don't
Yes.
have it during the night while I sleep, but during daytime, quite frequently, occasionally it happens. Is it a matter of concern or underlying?
Yes. So it's not a matter of concern, but it's quite common that can happen even during the day. It basically means there is some dysregulation in a chemical known as dopamine in the brain.
Okay,
So you must get it evaluated by a neurologist or a psychiatrist and start medication for it because it's a very unhealthy sensation and it's a chemical imbalance which is causing it.
okay, yeah, thank you.
Yeah. Uh, I think there's a question, a query about do we need to sleep on hard surface beds, beds that have a hard mattress? Because earlier the recommendation was for memory foam, but nowadays again people are recommending hard surface. So anything,
See, as long as your mattress is not is uncomfortable, so it's uncomfortable. It's got clogs or it's not. It's too soft and you're sinking in. Any kind of mattress which is firm, whether it is memory foam or hard, it doesn't matter. It should be a firm mattress. Some people can sleep without a mattress on the floor better than they can sleep on the bed, right? So the surface should be just a little hard. That's it, not
right?
too soft.
Okay. Early dinner and a walk before 7 helps to sleep better. Sometimes indigestion disrupts sleep.
Yes, very true. So there was a comment on this.
Right. So there are people who tend to fall asleep in the middle of the work in the day. So that is again because of improper
Very
sleep.
poor night sleep. And
Yeah.
sometimes you don't even realize that you're not sleeping well in the night,
Mhm.
especially people with obstructive sleep apnea, because they
Correct.
don't realize that their sleep in the entire night is every few minutes their sleep is getting broken because of the apnea. Apnea means when your breathing stops. They
Correct.
stop breathing, then they start breathing again. So those few seconds of constant waking up by the brain and they think, oh, I slept at 10 o'clock, I got up at 6 o'clock. But throughout the day, I am tired and exhausted. So,
Right.
most common things that people are not noticing that they're not sleeping well at the night is if they have obstructive sleep apnea.
Correct. Okay. Yeah. Any other question? Please unmute and ask. This is your time. Uh, yeah, Doctor. One of the things about is also sleep during travel. Uh, there have been people who stretch themselves. So, how much time can you stretch yourself for sleep if you're not able to get sleep properly? Also, any comment on sometimes people are driving and they fall asleep on the wheels. So, any comment about that?
Yeah, so see, we have to understand that our body will follow the circadian rhythm. And the circadian rhythm is like a clock. It is not only present in your brain, it's present in each and every cell of your body. So you try to follow your circadian rhythm as much as possible. So try to avoid this, driving in the night. If there is suppose a situation where you can't avoid it, then make sure that you park your car aside, take that small power nap for 15-20 minutes, and then get back on the road.
Okay.
People who travel undergo jet lag, or people who have especially shift duties. A
Hmm.
lot of people who work in call centers have shift duties. Then the the circadian rhythm is the way it is. You just have to adjust your clock according to your work times.
Right. Yeah. If I go to sleep at 10 p.m., this is I've received it on my personal chat. What time should I have dinner if I want to sleep at 10 p.m.
By 7:38,
by 7:30?
at
Okay.
least 2 hours before you go to bed.
Correct. Correct. Yeah. I feel more sleepy during the day, especially when I read books. I feel sleepy. So, okay, this
As
is
long as you're sleeping well in the night, don't worry.
yeah, correct. Yeah, okay. Uh, yeah, Doctor. One of the thing also is the whether this is a assumption that's wrong, because retired people tend to sleep at odd times, and then people in the home also encourage them to keep on sleeping. You're retired, you're okay. But is that excessive sleep good, or does it, because if you are in bed most of the time, then it could affect your health in many other ways. So any comment on that?
So one is, as you grow older, your requirement for sleep is lesser than, so babies sleep for 16 hours, and as we grow older, our requirement for sleep is lesser. So senior citizens' requirement for sleep will be lesser than a young adult. So you
Correct.
have to understand that, right? So this sleeping during the day is something that we absolutely tell the senior citizens not to do. What happens is it starts slowing their brain process. So now this whole concept of retirement is actually something that we should stop. So you may retire from your work, which is fine. You have at 60 you're retiring, but you have to make sure that you are doing your brain activities continuously throughout the day. So even if you're retired, you wake up at a particular time, you go for your walk. If you're not able to go, many of the time senior citizens are having mobility issues. You sit in your place during the day, get off the bed. Again, I said, don't sit in the bed or lie down in the bed. Keep a small chair next to your bed where you can get off and go and sit down. You can do Sudoku puzzles. You can do mandala art. You can say your prayers. You can, do some drawing. Something that will keep your brain active. New learning. I think and COVID has really helped us with that. There are so many courses available, so many things that the senior citizens can join in online without leaving their home, which keeps them engaged socially as well as in their brain activities. So do that during the day. Take small walks around in your house and reduce your daytime lying down in bed. Because many times you will say, I'm not sleeping, I'm just lying down in the bed. So don't lie down in the bed unless you really need to.
Right, right. Yeah, somebody's asking for PowerPoint details, but I think you could just catch it on YouTube if you want, so you can take a screenshot from there. Okay,
Yeah, I mean, it's a very the normal slide, so you can always see it on the YouTube link, like you said, and you can.
right. Yeah, okay. So I think people are appreciating that. Doctor, any advice for young mothers with babies who maybe they struggle to sleep, or even whether what are the creative ways they can catch up on their sleep, and is there any method for the baby to sleep? I do not know. Is it something they just have to go through?
No, it's not something that they should go through. So when you have a baby, especially in the postpartum period, a young woman or a young mother goes through a lot of hormonal changes, and her body requires that rest and restoration. So it is the onus of the other parent, the father, or everybody else around to make sure that the mother is sleeping well. So many times they will say you go to sleep when the baby is sleeping, but it's not possible for every person to go to sleep at 11 o'clock in the morning when the baby is sleeping. So in the night, somebody else has to share responsibility so that the mother gets at least 2 to 3 hours of uninterrupted sleep. If that means you're, pumping the breast milk and feeding the baby, otherwise that's also okay, right? Allow the mother to rest at least for 2 to 3 hours at a stretch. Young mothers must realize that you have to take time out for yourself, because if you are not going to be fine, your baby is not going to be fine. So during the day, also try to do some maybe 10 to 15 minutes of activity for yourself. Walk about, take smaller naps during the day, read something which is interesting. When you do all these things, your mental health will also be better, especially postpartum.
Right. Yeah. Any other
For
question?
babies,
Yeah.
for babies also, our young children, it's very important that we set that routine for them. See, when the babies are very, very small, it's very difficult because they follow their own cycle. But as the children grow a little older, let's say by the time they're 9 to 10 months, till they're, adults, it's very important for families to have a good sleep schedule. I see so many of my patients who come to me who say, oh, they come back from work at 10:30, that the family's having dinner at 11:30. Children are going to sleep at 12:31 and they still have to wake up in the morning at 6 to go to school. And then they go to school and they're not attentive, they're hyperactive, they are restless, or they're sleeping in class. So it is the onus of the parents and the family to make sure that children have a good bedtime routine. Children should be, younger children should be in bed by 9:30, 10, and wake up in the morning by 6:37. At least half an hour to 45 minutes before they have to go to school.
Correct, yeah. There's a question that has come anonymously. As women enter their late 40s with hormonal changes, why is it so difficult to fall asleep in spite of being exhausted from the day task?
So, like you correctly said, menopausal changes that you under. It may not be menopause, but you can be perimenopausal. And these hormonal changes can happen from 5 to 10 years before you actually achieve menopause. And if you're struggling to fall asleep, then you must take help because this is more of a chemical imbalance rather than you not being able to fall asleep. So the brain is not shutting off, and that's because of a chemical imbalance. So if you are a woman in the 40s struggling with sleep, it's despite following all the sleep hygiene methods, please reach out to help your doctor.
Correct, yeah. Right. Any other question? Please go ahead and ask. We are just we are free to close. I think there's a lot of appreciation on the chat. Thank you for the very informative session. Very helpful and challenging thoughts. So it's good. I think a lot of sleep deprived people are very thankful. So any question? Please go ahead. You could unmute and ask. We are about to close. Doctor, one of the thing also I've noticed since it's predominantly, I hope that there are Christians here, so that there's just a bad attitude towards sleep in general. People associate sleep with laziness straight away, and sometimes when you come from a strict home, there's just so much you are actually made to feel guilty. Even women are made to feel guilty for sleeping more. So
That is why actually I started my slide with why do we need to sleep? Because this is a very common thing that you've put the point. We always feel that if you're sleeping for long hours, then you're lazy. Or why do you need that sleep? And if you go back and understand that sleep is the most essential aspect of all the health related factors that are there. If you see now recently, you've seen so many young people with cardiac events or heart attacks, and they are healthy people, exercising, healthy lifestyles. And one of the important aspects that we probably have missed is those people are having sleep issues or high stress levels. So if you are sleeping well, then your body undergoes all the restorative functions.
right, yeah. There's a question that has come privately again. Is headache and sleep related? Is there a relation between headache and sleep?
Yes, so headaches can be because of multiple reasons, and one of the commonest reasons for headache is stress or depression. So depression and anxiety can also present as headache, and headache and sleep are also other symptoms of depression and anxiety or stress. If you are unable to manage the stress in your life, you may present with pain symptoms. It need not be just headache. It could be chronic muscle pains, chronic backache, and of course, it's accompanied with sleep. So that is something that we must get evaluated.
Correct, yeah. So, friends, any question, any closing comment, please go ahead and ask, because then you won't get the chance to ask Dr. Cheryl. You will have to visit one of the
Everybody's feeling sleepy now.
Yeah. You could please put your appreciation on the chat, because that's the least we can do. We really want to thank Dr. Cheryl for giving her time at the end of the day. And I think some people have fallen asleep also by now on the program. So it was so effective, the talk. Yeah. So I think definitely we are so thankful, Doctor, because sleep is now something so precious, and we all need it, and it's a very important topic. So thank you so much for being ready to speak on this, so we could actually address it. We hope to see more of you in the days to come.
Thank you so much, Michael.
Coffee chats,
God
and
bless all of you.
yeah, there's so much of appreciation on the chat. Yeah. No two ways about it. I think there's somebody asking about in-laws pressure. These are things we have to tackle, I think, separately. So thank you so much. Thank you. God bless you, doctor.
Thank
We are
you.
so grateful.
Good night, everyone.